We look for sources of data that come from publicly available media sources. So some of it is social media, like Twitter and Facebook, YouTube and Vimeo, some common sites like that. But then other portions of the data come from maybe less used sources of public health monitoring or media monitoring, so including broadcast television, print news, radio, things like that. So that it all gets kind of sucked up into our machine, and then we categorize all the data separately and then together. So if you're familiar with kind of data science principles, we do a lot of triangulation, because what we don't want is for what's happening on Twitter or some sort of conversation that's occurring on Twitter to drive our assumptions about national discourse if that same conversation is being framed a totally different way on like broadcast television. So we want to compare them to each other and then collectively arrive at, okay, what does the actual conversation look like? Yeah, so we would weight them just like you were comparing two sample sizes that were very different. But I think the main thing is just being transparent about where the data comes from and the different sizes. So when we would report that to like a partner or a stakeholder, we would just say, so this is how it's being portrayed on broadcast. This is Twitter. This is what we think it means put together, but keep in mind they're different if they're taken separately. The opioid monitoring that we're doing was really interesting. We started that with the National Academies of Science as a partner, and we were interested in it. Is there a difference in what people who live in rural areas are exposed to in terms of messaging about opioids versus people living in urban areas? And it turned out that there actually was quite a big difference in terms of what people are seeing, but also in terms of what people are saying. Because there's the thing that someone sees, and then there's the way that the public reacts to that thing. So we look at it from both those sides. That's where partners really come into play. So PGP, or the public good projects, we do campaigns, but often when it comes to our monitoring, we just find the data and then analyze the data and then provide the reporting on that data to a partner that's more on the front lines than we are. So it could go to state health departments or federal health agencies or health systems. So it's often on us to have to create our own distribution network for the findings. As far as we know, we're the only organization that uses all of these different types of public media data. And I think one of the reasons we got there first is it's difficult to do. You actually need a team that's intentionally built to do that work. So it wasn't like we had an existing core staff and then we retrained everybody how to do this. We actually had to have half the staff be data scientists and the other half be public health professionals and train them how to work together. And then it takes 3 or 4 months to get one of these monitoring profiles up and running where the data is verified and helpful. So it's not something you can kind of just jump into and do quickly. I think that's probably the chief reason. With funding from Kaiser Permanente, we created a way to monitor the public conversation in the United States about mental health. So now that that's been built and data is coming back, we can actually see the different ways that people conceptualize all of the most common mental health conditions, and then the way that the conversation shifts day by day and week by week. So when people mention schizophrenia, how are they talking about it? Or when they're mentioning depression, in what way? But then we can also see differences by geography. So Kaiser Permanente is in 9 states, and we can see, is there a difference in the conversation around mental health in Georgia versus Hawaii? And there almost always is, which gets really fascinating if you're a data nerd, because then Kaiser can say, oh, wow, so our frontline staff that are in Georgia should understand the cultural nuances that are occurring around things like depression versus the cultural nuances in Southern California or in Hawaii. So we entered into it without knowing what the results were going to be, and it's been really fascinating.